thoughts and expertise with our community.
Thank you. Thank you for having me. I'm Dr. Shannon Hudgins. I'm a palliative care physician in the Houston area, and I work inside of the hospital. And yes, I have seen several COVID positive patients with palliative care. We're involved a lot with symptom management and helping patients and families talk through their medical care. And unfortunately, I have had patients who have died of the COVID virus. So for me, it is very serious. It's what I see every day. Um, but I am honored to speak to the community and share some of the things that I have learned. And I'll spend the first half of my speech talking about the risk factors for why Black people are getting more serious infections. And then the second half, I'll spend talking how we can empower ourselves individually, starting right now and today, on how we can flatten the curve within the Black community. As
Right.
far as Black people and the coronavirus, there's nothing about our makeup or our comorbidities that puts us at higher risk for getting the virus. It's just when we do get the virus, we have a more serious infection. The majority of people who are getting the coronavirus, almost 80%, have a mild case. But there are a minor, and the majority of people are surviving the coronavirus. A good percentage of people were also learning, somewhere between 25 to 50% of people have the coronavirus and never have symptoms. And that's something that we're finding as we're testing different patient populations. The reason why we as Black people tend to have more serious the more serious version of the coronavirus is because we do tend to have, as you discussed earlier, we have more issues with asthma, lung problems, all of which can be related to our environment. We have higher risk of hypertension, diabetes, cancer, any disease that compromises your immune system will also put you at risk for having a more serious coronavirus infection. And by that, more serious, I mean requiring hospitalization. Most patients who have the coronavirus who do require hospitalization do survive, but that is a significant time that families are away from their own families, their own community. You can't work for 2 weeks, and now the hospitals are essentially shut down as far as additional visitors. So a lot of patients are there by themselves. And obviously, with the Black community, a lot of our health issues are definitely directly related to health disparities, racial disparities within the medical community. The NIH has done a study over the last few weeks that noted that coronavirus testing is much lower in minority communities compared to white communities. We also tend to be less insured. We also tend to work jobs where our employers are not paying for our insurance, and there's also biases within the health professionals, within doctors, nurses. Like you mentioned earlier, Black women are not believed. Black people in general were not taken as seriously regarding our health conditions, and a lot of our conditions, the medical community just relates to, oh, it's just poor health or poor choices, instead of looking at the historical implications and the mistrust that we as a community have built necessarily with the health community. We've not been a part of it. It's only been the last generation that we've even been a part of the medical community. My parents, grandparents can remember a time where Black people couldn't go to the hospital, and to think that all that has erased itself in 20 years is you know being very optimistic. And so, how can each of us, those of us who are listening today, empower ourselves right now? First, just knowing the signs and symptoms. of the coronavirus. Fever being one of them. Fever being defined as a temperature greater than 100.4, which we see in about 80% of coronavirus patients. Cough, shortness of breath. Those are the more severe cases. In milder cases, people tend to have more GI symptoms. They can't smell, they can't taste. Um, your other first line of defense is social distancing. A lot of uh, Black people cannot stay at home and work. Only 20% of us have jobs where we could work from home. So we also have to practice social distancing. And we know that this works because with the Spanish flu in 1918 in St. Louis, they instituted very strict social distancing. They down all the schools, they shut down all of the places where people gather at the time. Going to the theater was the biggest moneymaker, and obviously the theater owners were not happy about it. But they had about 700 people die in a month of the Spanish flu in St. Louis, whereas in Philadelphia they did not institute social distancing, and they had about 10,000 people who died. So we know from history that this is very, very important. Washing your hands for 20 seconds is a known deterrent of infection, and the medical community has known that for many years. Washing for at least 20 seconds, making sure you get your thumbs as well as your wrists. Using hand sanitizer if you can't wash your hands, making sure that you let your sanitizer take effect for 20 seconds, and then also wearing masks. It's a shame that the CDC has been late on using the face coverings, which is a mask, but they've had studies as far back as 2005, maybe even further, that prove that masks do decrease, in addition to all of the other um, procedures. And then also desanitizing, which is a two-step process. Desanitizing your surfaces, your handles in your home, um, washing with soap first, and then using sanitizer like Lysol, Clorox, or just simple bleach if you don't have that. And then obviously don't touch your face. And those are the main things that we can do today. In addition, I'm also a palliative care physician, so I also talk to patients about their care. And one thing that we as a community need to start having, not only in relation to the coronavirus, is start designating that person to speak for you when you can't make medical decisions, and filling out the living will that says, hey, if something happens to me, this is how I want to be treated. They're hard discussions to have, but we need to have them as well, so we can direct our care when we can't talk for ourselves.
Great. Now, you said you're a what kind of care physician? Because I don't think
Palliative
most
care.
of us know.
Mhm.
What is that?
Yeah. So basically, what a palliative care physician does is we help patients talk through their medical care and come up with medical plans so that we're honoring patients' wishes, especially when they have very complicated health care and medical care and chronic diseases that may compromise their quality of life. And we
And
treat a
so,
lot of symptoms.
Dr. Hudgins, there's just that we only have a few more minutes before we have to bring on the next guest, but we do want to check in with you about these underlying conditions, because we know that we're walking in with diabetes, with high blood
Mm-hmm.
pressure, with asthma, with all of the things that you just mentioned that make the effects of the coronavirus more serious. Um,
Mm-hmm.
where does that come from? Why are we so, why are underlying conditions so prevalent in Black communities?
Well, I think that's a complex issue. I think that a lot of it does come from our communities not being set up that in a way that promote a healthy lifestyle. A lot of our communities don't have sidewalks. We don't have the parks. We have the food deserts. We don't have doctors and nurses don't tend to take our concerns seriously. So it's definitely a combination of the racial disparity of just being black in America.
So we're seeing people type systemic racism, structural
Mhm.
racism. People are also saying though that we're addicted to food.
Mhm.
Um, and there is some of that. There is some of a good friend of mine writes about how some of the stress of being black is
Mhm.
because of the racism, right?
Mhm.
So we're
Mhm.
stressed out
Mhm.
because of the constancy of the racism. Um,
Mhm.
However, that doesn't mean that there aren't steps that we can take to
Mhm.
make ourselves healthier, even though, the underlying conditions aren't necessarily our fault, right? So we can't blame diabetics for being diabetic, right?
Mhm.
We can't
Mhm.
blame folks who have hypertension for having hypertension, but there are steps that we can take to fight back against these underlying conditions. Wouldn't you
Mhm.
say?
Yes, absolutely. There are steps, just being involved and being aware, voting in your local election,
Mm.
and then also um, getting with friends and looking around. And a lot of black communities do have gyms, do have places where you can walk, and there are a lot of you can go to. There's a co-op in a black community here, where you can get a lot of fresh vegetables and farmers markets. So there are things that we can do and try to promote as a community and just encourage each other to live a little healthier and be a little healthier.
Thank you so much, Dr. Shannon Hudgins. And